Hello, everyone, and welcome back to Fraud in America. Today we have whistleblower attorney Mary Inman from Whistleblower Partners and her client Teresa Ross, who is a former employee of Group Health Cooperative, which is a private insurer doing Medicare Advantage work, which we will discuss how that plays out in a little bit. And she brought her case alleging Medicare Advantage fraud against her former employer, as well as an outside data analytics firm, which is DXID, as well as their parent company. And then we'll kind of get into what Medicare Advantage fraud looks like in a little bit. The first settlement against her former employer was back in 2020. And then just in time for the holidays last year, we got the settlement against DXID and its parent company, Independent Health Association. So thank you all so much for being here today. We really appreciate you coming on.
Thank you.
Yeah, thanks, Jackie. It's great to be here.
And so just at a high level, basically, Medicare Advantage fraud involves submitting codes that are inappropriate to the government in order to receive higher reimbursements. And I'll let one of you all kind of go into that a little bit more later. But the settlement against your former employer, the private insurer, was for almost about $7 million in 2020. And then this more recent settlement was for up to $100 million against the outside data analytics company as well as the CEO. And that's really notable. There's not a lot of times where you get settlements against individuals in these cases. And I think that that's really saying something that you were able to do that, especially when you weren't actually working for that company, you were working for the private insurance company. So it's a really interesting case, and I'm ready to get all into it. But first, I want to get a little bit of Teresa. Can you tell us a little bit about your background, your experience, and how you ended up at the company?
You bet. So back when I was in school, I showed a particular aptitude in math and really kind of decided that that was going to be my career in some sort of business fashion. So I actually started my career as an insurance underwriter and worked with actuarial teams at the various companies that I worked with. And one of the things that I was hoping to do was to develop my own risk adjustment algorithm. And the original intent of that was really for insurance underwriting. However, I started seeing a lot of fun things come out there in the early 90s about the potential for analyzing data and creating a risk profile for individuals so that you would have that and know how risky a group's population is relative to other groups. And so it was a really good way for us to justify our rate actions for various employers. Then in Washington State, there was a risk adjustment program adopted for the Washington State employees. And that's really where I kind of cut my teeth on it. And that was back in 98, 99 timeframe. And then I worked at Group Health, basically had a large list of responsibilities, but then ended up developing even more of a passion for risk adjustment and ended up building the programs that allowed us to do some patient outreach and those types of things. We did some coding review as well. But our philosophy was not just about let's get the money in the door. It was about let's make sure we're taking care of our patients who are chronically ill and make sure that they come in for a visit at least once a year so that we can address all of their chronic conditions and that they're being treated. Others in this space have decided to really just take a chart review, or at least back then we're taking a chart review only type approach. And that approach was great as long as the providers were documenting in the medical records what was wrong with patients. Well, that wasn't happening as often as we'd like. And again, the reason for the outreach was to make sure that doctors actually did facilitate care for these patients. Not that they wouldn't have anyway at Group Health. Group Health was always very patient-centered, so that's really kind of how we thought about things. There are some in the industry who have done some nefarious things to facilitate more money being received in the chart review process. And that's exactly what was going on with DXID. So DXID's approach to this was let's figure out how we can, if the doctors didn't document things in the medical record, their approach was let's put an addendum in the medical record up to a year or more later and say that the doctor addressed this, and we'll have him just sign a piece of paper saying he did. Well, Group Health was not going along with that. So we opted not to do that. But DXID and their largest client and owner, Independent Health, was doing that, which was really kind of a big no-no. And I think most people in the industry, even during the time that this was happening, were saying the very same thing. You can't just do this. The Medicare participant guide that was put out related to risk adjustment very specifically said you couldn't do it, but they did it anyway. Also, DXID was being paid on a percent of the take. So they got 20% of anything that group health got, which in itself is not an awful thing as long as you have people that are honest and ethical, but these people weren't. So even group health, agreed to do some of the things that DXID was doing, but even when group health made those decisions, DXID would code things anyway that we said not to code, just because they were getting the money. And nobody was watching at first what they were doing until our director of coding caught wind of it and said, wait a minute, what's going on here? And started raising concerns about it, as did I. So I ended up going through and auditing some of the charts that they were using to submit codes, and found that I think it was almost a 60-some% error rate in what they were doing, that about 60% of these would not have passed RADV, which is the audit mechanism for risk adjustment. So I expressed concerns within my organization.
Let me stop you for a second. Because let's go backwards a little bit. First, I wanted to let Mary kind of introduce herself and give us her background, and then Mary, could you go into kind of how Medicare Advantage works before we get into the fraud part, just so people can level set a little bit?
Sure, absolutely. Mary Inman, I'm a partner at Whistleblower Partners, and I've been practicing as a whistleblower lawyer under the rewards programs for almost 27 years. And it's been 12 years with Teresa, so a good part of my career with her. Teresa actually helped me very early on in learning what risk adjustment fraud was. So it's kind of ironic that I'm describing this to the audience, because she taught me everything I know. So a lot of us are familiar with managed care. We have HMOs. Medicare got in the business of managed care, and we call that Part C Medicare Advantage. That's the name of their managed care. So under managed care, you're not paid as a health insurance plan based on, or a doctor based on each type of care that you deliver, not on a fee-for-service basis, where that's what's under traditional Medicare. To encourage people to treat people preventatively and prevent people from getting sick, they went with an HMO model, and you are paid based on an actuarial rate. So if you're a 71-year-old woman in South Florida, there's a certain amount that you get paid. That's called a capitation rate. And what happened in Medicare, and Teresa's been there from the ground floor, is when it was just calculating your payments based on the actuarial data, health insurance plans started having open enrollment days on the fifth floor of a building with no elevators, offering gym memberships. So the idea was we only want to insure healthy people, and that wasn't right. So they realized we need to actually have something called a multiplier, risk adjustment score, or RAF score, also known as an HCC, for giving you all those kind of acronyms. Was that if you're treating a sicker patient, someone who has certain types of comorbidities, we'll give you a multiplier for that score. So lo and behold, as you can imagine, what we started to see then is if you can get a higher reimbursement based on this multiplier, which often can be very significant sums, we started to see people being prevalence rates for certain diseases going way up compared to what they really were normally in the population, like severe malnutrition, things that we only expect to see at certain levels in sub-Saharan Africa, starts popping up everywhere, to give sort of one example. So while Teresa would say and will say that risk adjustment is a great model, it was certainly able to be manipulated. And so that's what we've started to see, is it's almost become an industry-wide practice, because it's one of the few levers you can pull as a health plan to really increase your ROI. And that's exactly what happened in Teresa's case. So we can talk sort of about, and probably should talk about, how her employer group Health Cooperative came to a position where they hired the unscrupulous, now former coding firm called DXID. They're now defunct, I suspect largely because of these practices. But it really was that financial motivation behind it, that group health was in a very precarious financial position when a CFO at a conference was introduced to DXID, who said, as Teresa just said, we're contingency fee based. There's no skin off your back. It's not going to cost you anything to bring us in and look at your codes, and we will maximize your risk scores. They may not be accurate, but we'll certainly maximize them. So that's just a little bit of a nutshell about what Medicare Advantage risk adjustment fraud really means. It's improperly making patients look sicker than they are by enhancing their risk score and quote unquote treating them for conditions that they don't really have.
Right. And about over half now of Medicare patients are on Medicare Advantage plans, and we're talking hundreds of billions of dollars going into these plans. And so when they're committing this kind of fraud and receiving higher reimbursements for the government than they should, that's all tax dollars coming out of our pockets to the tune of billions of dollars. So Teresa, let's go back to kind of talking about the fraud, how you found it, and kind of what it looked like. And if you did want to go into a little bit more detail about kind of, I guess, the motivations behind kind of getting a company like DXID to look at your codes and kind of figure out how to maximize reimbursement.
Right. So again, as Mary mentioned, there was a meeting that occurred that the CEO from Independent Health and the CEO from Group Health met, and that's how Group Health ended up bringing in DXID. What was interesting about that, just that particular thing, is that Group Health had an RFP process that most things that they contracted for would actually go through that RFP process. All of this was bypassed, and it was all done very quickly at the end of the risk adjustment period. So this was all happened within like a 2-month period for the first year. And I was being asked, with the fraud, I was being asked to basically sign off on the data that was being submitted, saying that I agreed with it. And I said, no, I'm not going to do that. Well, during this time, DXID is continually trying to talk us into doing more and more risky things. And in that process, I learned a lot about what was going on at Independent Health and how they were doing things. Now, again, Group Health wouldn't go all the way on all of those things, but they did certainly on some that were no-nos. So from there, I decided I was going to start auditing things, which I did, and found a really high error rate that we talked about before. And things like they would take a diagnosis from a problem list. And if you can kind of visualize the old days where you had a medical chart, usually on the inside left side was a list of patient problems that they would have. But that doesn't necessarily mean that they were treated or even still accurate. In one particular example, I'm reading the chart, and the chart says that this guy had situational depression and that he had a particularly sunny disposition and was taken off all of his meds. But because it was on a problem list from a prior year, DXID felt compelled to code it. It was clear that the person was not being treated for depression any longer and was no longer on. So that's just one example of many. We had a female coded with prostate cancer because her husband had it, I guess, or it was in a chart. And so they thought that they could go ahead and code that. So there were many examples like this that was very careless. And we even found out that some of the coders that DXID had weren't even certified coders. So
yeah,
it was all a bit race for money.
Yeah, absolutely. And so when you are starting to see these things, what did you do next? Like, how did you go internal to your company and try to convince people to stop this?
At first, I went to my direct supervisor. He actually didn't really understand what was going on or really understand risk adjustment at all. It was just kind of my thing, and I ran it. And so he didn't do anything. Well, then I talked to some of the other coders, which later I was told we can't talk to coders about this stuff internally, which was a big red flag for me. And then also went to talk to the head of internal audit. They suggested I call the whistleblower hotline, which I did. And it wasn't really, I wasn't thinking of this as something that I would blow a whistle on at all. But I was worried about my job. So I'd been there 12 almost 13 years by this point, and I wanted to save my job. So I went to an employment attorney, and the employment attorney said, no, I think you probably need to do something different than that, because this isn't an employment issue as much as it is a fraud issue. So they suggested I contact a whistleblower attorney, and met Mary, and long 12 years through slogging through the investigation and the delays here and there. Of course, COVID didn't help, but we ended up in a good space at the end of it, which I'm very thankful for. You asked how I came to it. So, that's how I came to it. And then you also asked that you may ask if I would do it again. Well, out of that 12 years, there was really only one time when I felt like, boy, I, this is not going to work out for me. I called the attorneys and said, can we just cancel this whole thing? And I think this is like at year 9 or 8 or 9 that I'm saying this, right? And that was after I did lose my job. So just so that we're clear, I was technically laid off, and I understand, because I ended up going to work for a vendor. Well, nobody wants to hire a vendor who's got a whistleblower on their team, right? So as soon as the case became public, I was regretting it pretty badly. And I tried for over a year to get another job and wasn't able to. I don't fault the company that let me go, because they're a vendor, right? And I was in the marketing area, helping them with explaining and developing models. And so I get why they did what they had to do. Am I sad? Because I love my job, but the worst thing was that now everybody knows. And, 80 job applications later, I just said, I can't keep doing this to myself. I ended up in a with pretty major depression, as well as a lot of autoimmune issues. Are slowly starting to resolve, but some things are just never going to go away. My hands are, you can see how bad those are. I can't do much with them anymore. So yeah, it was a hard time.
Yeah, that's a huge risk to bring these cases. And again, we salute you for doing that and taking that step. And you suffered what a lot of whistleblowers suffer, which is you try to do the right thing internally. You don't necessarily even have a whistleblower lawsuit in mind. You just want these issues to stop. And then, you end up where you end up, and then you get retaliated against. And can you talk a little bit more about internally what kind of retaliation you faced when you reported the fraud to your supervisors?
So, after about 4 or 5 months into this, we're meeting internally at Group Health weekly to discuss policy issues and what we're going to allow DXI to do and not do, etc. I was still objecting to things, and so they actually sent a psychologist to my office to meet with me. And so I end up having an hour-long meeting with this guy, and actually I ended up wearing a wire in that particular discussion. So I had the whole thing. I've gotten rid of everything that I had, actually, but I had the whole thing on tape.
So
where, he's suggesting, well, everybody else seems to be fine with this and is going along with it. What's the problem? So that was one thing. And then another thing that happened was that over half of my department was taken away from me. So they ended up wanting me to only focus on risk adjustment and not all of the other things that I had been doing, which I thought was interesting. So I lost them. And then I started getting excluded from meetings. So the higher ups would meet and I was not allowed to be in the room anymore. And so that, again, red flags all over the place. Like, okay, we can't.
You're running the department.
Yeah, you can't talk to coders about it. Exactly. I can't talk to coders about what's DXID's doing. And I can't be around when the leadership is talking about it. So what are we hiding, right?
Right.
If you have to hide it, it's probably not okay.
Right. And so once you had filed your case and the government started investigating, Mary, can you talk a little bit about your interaction with the government, what the investigation portion was like, and how your firm kind of worked with the government as well?
Yeah, so the case, I always talk about this case as the through line is DXID, the vendor. And I think a lot of people are used to hearing about risk adjustment fraud and think it's the provider groups, it's the doctors, or it's the health insurance plans. But this is one of those cases where, and one of the few, as you mentioned at the outset, Jackie, where the vendor itself was really the impetus for the fraud. And so in terms of what happened, and I think it was sort of the egregiousness of the fraud and the height of the error rates, like a 60% error rate, right, is pretty remarkable. And so the government team was great. We filed in the Western District of New York. It was originally Bob Trusiak and his team, and then Bob eventually left, and other attorneys came in, but they were very keen to wire her up. So we had criminal and civil AUSAs working the case, and they did knock and talks that were very helpful right on the eve of coming in and serving the CIDs and all of that. So we got some great evidence, and they all corroborated Teresa, which is terrific. So we had a great team. It kind of bogged down and slowed down with, as often is the case, with motion practice. And we got more momentum where I think ultimately GHC could settle by saying this was just a bad moment for us. We hired an unscrupulous vendor. And so, not coincidentally, the close to $7 million settlement, all of it related exclusively to the work that DXID did for them. So we had that settlement, and then interestingly, the same lawyers that represent a lot of the other health insurance plans in, for instance, our United Health Group case, they keep showing up. They showed up to represent independent health. So it starts to get a lot riskier for independent health as there's already blood in the water. GHC has settled. And Independent Health is the parent corporation, as you said at the beginning, Jackie, that spawned DXID. So DXID was an internal section, and Betsy Gaffney, the executive, the founder of DXID, started at Independent Health, and they spun out to their own practice. So as Teresa said, even though she didn't work at Independent Health, it was clear that from what she was hearing and interacting with Betsy and what Betsy was saying, we had enough information to be able to also sue Independent Health and say, this was on their watch. This was their brainchild. So that case ultimately settled last year. We did have motion practice that helped us along. It took a long time for the judges to decide on the motions. But once the motion dismiss was resolved, settlement happened fairly quickly thereafter. So that was sort of the practice. This was back in the day when people didn't know about risk adjustment fraud. So for Teresa's, you're asking about how we dealt with the government. For Teresa's interview, we came in a day early to teach them about risk adjustment so they'd actually understand what Teresa was saying. And Teresa sat for 2 days with them and then did a supplemental interview with them later because they've started to recognize she's not just a percipient witness, but she's frankly an expert witness for them.
Yeah, oh my God. Well, if she knows she wants to do math and risk adjustment from a young age, I guess eventually you turn into an expert in this, right?
And she was there from the inception. Like, risk adjustment didn't it started on a graduated basis. I mean, can literally say she was there from the very beginning. So I think, although it took a long time, how credible she was on both of those spheres and the work she did with wearing a wire, which was incredibly stressful, really helped ensure that the case got off to a good start.
Yeah, absolutely. That wearing a wire seems really kind of terrifying. What were you kind of feeling when you're in your office and having to, record these conversations?
It was definitely stressful, as Mary said. The thing that I kept worrying about, and there was no reason for me to worry about it, I just kept thinking, it's like a little tape recorder, and I kept thinking, what if the battery goes dead and it starts beeping or something in the meetings? So, I would run into the restroom, turn this thing on, put it in my pocket, and go to the meetings, and the whole time I'm thinking, oh, please don't. And fortunately, it never happened. Probably could never have happened because the FBI was on top of it. But I think that was my biggest fear, is being found out.
Yeah, absolutely. And so there's now, you mentioned that this is one of the first of these kinds of cases, and the government was just starting to understand it. But now there's many cases in this area because, again, over half of the patients on Medicare are in these Medicare Advantage plans. And I think the government is recognizing, as whistleblowers like you come forward, this area is ripe for fraud because of the way that the system is kind of set up in order for that. And because the government doesn't have the tools to, to audit every one of these companies to see if their codes are correct or do these external government audits. And that's why whistleblowers have really been key in this area, because you come in with inside information about this and you're an expert in this area. So you can really speak to what's going on. And the government's really kind of taking notice of the issues that have been pointed out in these kinds of cases, and some of the rules around this have changed. Can you talk a little bit about that?
So early on, as they started to realize that some of these diagnoses were being abused, they would actually change the model. So, for example, anybody that had an old MI in the old model, they would get a credit, and I think it averaged around $1,400 per person that had an old MI. Well, so then all of a sudden everybody's got an old MI. It's not something that most doctors would think about putting on a claim. So, the models as they were built were taking old coding data and projecting costs based on that. Well, when you start abusing some of these diagnosis codes, the equation no longer works. The same thing happened with hypoxia. That's something that you would really only probably see in a hospital setting with somebody who's having some severe breathing issues. But they started, in DXID's case, they started coding anybody who was on oxygen as hypoxic. Well, they must be, because otherwise they wouldn't need oxygen, right? So that's kind of the generalized statements that got, I think, DXID in trouble. Is, they'd say, well, anybody over 70's got chronic kidney disease. So, let's code everybody with chronic kidney disease. So there were lots of things that CMS did over time to try to dampen down those things. I think the best thing that they ever did was releasing the RADV audit guidelines. Because I think that was kind of the big notice to everybody that, some of the things you're doing are not going to pass on audit. So I think things started to get more cleaned up when that happened. But, again, there's still some vendors out there that were, promising big return on investment if you use them. And so they were still doing some of these things as well. The more credible vendors, which the majority of them are, were not playing those games, but, those like DXID certainly were.
Yeah, and I think, that's really important. It's not just the dollars that are coming back to the government, and this is an ability to pay settlement. So the fraud itself and what the penalties could have been are much higher, but this is still a significant amount of money coming back to the government. But even more than that, you've really changed the industry in some ways, whistleblowers like you in this case, but by bringing these things to the attention of the government, and the government is making changes to try to help to stop this. The fraudsters are always going to find their new way to commit fraud. But I think it's really important, this case and this kind of work in this area, especially when there's so many hundreds of billions of dollars at stake.
Exactly.
Well, any last words on this case? It's super interesting. And as a self-proclaimed non-math person, that's why I'm a lawyer, I guess. I am very impressed that you became an expert in this area, and love your love of math took you here.
Okay.
All right. Well, thank you all so much for joining us. We really appreciate it. Thanks everyone for tuning in to Fraud in America. Thanks to our sponsor of the podcast, Getnick Law, and we'll see you next time on Fraud in America.
Our annual sponsor is Getnick Law,
a boutique Manhattan law firm dedicated to fighting fraud and promoting business integrity. Learn more about the firm at www.getnicklaw.com. If you believe you've witnessed fraud against the government or on the financial markets, or want to learn more about the laws that exist to fight fraud, visit taf.org, where you can find a directory of whistleblower attorneys who work across the country. On our website, you can find information about the nation's whistleblower laws and programs, and a way to donate to our organization as we continue to fight attacks on whistleblowers and these laws. Fraud in America is presented by the Anti-Fraud Coalition. Jacqueline DeMar is our host. James King is our executive producer. The website for Fraud in America was designed by Wide Eye Creative. Our artwork is by PPA Agency, and our theme song is by Spatial Relations.